Hi everyone, my name is Ruth Foren. I have completed my master's degree in forensic psychology from National Forensic Sciences University, India. Now let's talk about forensic assessment instruments. According to APA, American Psychological Assessment, definition of forensic assessments is systematic evaluation by a mental health practitioner of a defendant, witness, or offender for the purpose of informing the court about such issues as competency to stand trial, criminal responsibility, and risk assessment. So now, when we are going to talk about the instruments, we have to sure the instruments have been standardized, which means that the standardization also concerns administration, procedures, scoring, and interpretations of the results. An example of the standardized test is the Wechsler intelligence scales and the various forms of the MMPI, such as MMPI 2, MMPI 2 revision, and MMPI A. The test manuals for both the adult and child versions of the Wechsler intelligence scales clarify the conditions of the test administration, scoring, results, interpretations. In addition, the test does have applicability limits with the forensic arrangement properly. Forensic assessment falls under two broad categories. First is civil, then the second one is criminal. Civil areas of practice include the relationship between members and the community, and the goal is not to punish a wrongdoer, but to prevent or compensate for a wrong. Examples of civil cases are custody evaluations and personal injury litigation, while criminal practice typically includes cases in which criminal laws have been broken, and the goal is to appropriately punish the wrongdoer. Examples of the forensic assessment in criminal law would include competency to stand trial evaluations and sanity evaluations, in addition to capital sentencing mitigation. There are three major in forensic assessments. First is forensic assessments instrument. Second one is forensically relevant instruments. And the third one is clinical assessment instruments. Forensic assessment instruments focus on psychological constructs, and forensically relevant instruments focus on clinical constructs that are sometimes pertinent to legal contexts. Examples of forensically relevant instruments include those used to assess malingering and test taking set, recidivism, violence risk, and psychopathy, and clinical assessment instruments is referred to standard psychological tests that primarily designed to assess clinical constructs such as anxiety, depression, psychopathology, and anger. Now I'm going to talk about common instruments used in forensic setups. First, Minnesota Multi-Basic Personality Inventory, or MMPI. This MMPI, it include any versions of it. So this personality assessment is a psychological test that assess personality traits and psychopathology. It is primarily intended to test people who are suspected of having mental health or other clinical issues. MMPI is used in neuropsychological, workers' compensation, personal injury, child custody, family violence, and criminal evaluations. And also, number two, in assessing violence risk in juvenile and adult offenders. Most instruments use also MMPI, structure assessment of violence risk in youth, for adult clinicians, and most commonly used tests include the hair psychopathy checklist test, historical, clinical, and risk management, or HCR20, sexual violence risk 20, or SVR20, risk for sexual violence protocol, or RSVP. So these tests include psychopathology tests, cognitive tests, risk assessment tools, and psychopathy tests. Then we are going to talk about another test, that is Wechsler scales for intellectual, and also for another test we also call it Wechsler memory scales. Okay, or WMSR. There is also actually Wechsler memory scales, and another one is revised, which is also for cases in personality injury. The instruments to assess response style or malingering. There are and also for competency to stand trial, or CST, and mental state at the time of alleged evaluator, or MSO, and non-sexual violence risk. The tests using on those uh, cases, we use also here MMPI 2 and NCMI, test of memory malingering, or TOMM, and evaluations of competence to stand trial revised, or ECSTR, MacArthur Competence Assessment Tool Criminal Adjudication, or we call it MEC CAT CA, and Juveniles Adjudicative Competence Interview, or JACI, and Personality Assessment Inventory, or PAI, and projective techniques. This projective techniques exam, I will give you the example is like Rorschach Imbot test, thematic appreciation, perception test. Then psychopathy checklist revised, or PCLR. Most frequently used tool in violence risk assessment, and was also common in sex offender risk assessment, civil commitments, aid in sentence, and insanity evaluations. Those instruments that I talked already can be either specialized forensic instruments or forensically relevant instruments. Specialized forensic assessment instruments are measures that are directly relevant to specific legal standard and reflect the focus on specific capacities, abilities, or knowledge that are embodied by the law. So we have already identified the MMPI as a common use measure of personality or mental illness. This traditional clinical measure might routinely be used in insanity evaluations to assess mental illness. However, a forensic psychologist would have to infer the degree to which a person's mental illness would impair her or his ability to distinguish right from wrong. Whereas specialized forensic assessment instrument, such as the Rogers Criminal Responsibility Assessment Scales, or RCRAS, would more directly assess the degree to which the defendant's ability was impaired in regard to legal charges she or he focused. After we talk about the instruments in forensic assessment, we can't forget something that's really crucial in forensic setting uh, as well, mm, which is we call it archival information. So forensic psychologists especially must rely on archival information because there are two reasons why uh, archival information is very important. Because number one, there is a greater need for accuracy in forensic evaluations. A forensic psychologist's conclusions will be evaluated by the legal system, and lying on and faking psychological symptoms is especially relevant. That is not to say that therapeutic evaluations can be inaccurate. It means that not only are individuals' mental health at stake in forensic evaluations, but so might their personal freedom, their life, or even the well-being of other person. Because of the adversarial nature of our legal system and the heavily scrutinized and critiqued by a number of people. These people could range anywhere from the defendant to the judge and the opposing attorney. As a result, consulting archival and third-party information is especially very important. Second reason why uh, archival information is very important because uh, the high likelihood of secondary gain in forensic evaluations and the increased likelihood of malingering as a result. A forensic psychologist can be expect examinees to underreport symptoms in a variety of situations, such as child custody decisions or other symptoms. Okay, maybe like insanity or personal injury cases. In all of these cases, the examinee has something to gain, whether it is her or his advantage in addition to their primary goal of overreporting psychological symptoms that may influence the accuracy of an examinee's self-report. It is important that a forensic psychologist be prepared for these circumstances and seek out archival and third-party information, as well as be aware of different approaches to detect malingering through formal assessment. Uh, Strategies to detect malingering is with the clinical interviews. Several indications of potential malingering might include uh, exaggerated and dramatic presentations in noticeable deliberateness and carefulness, presentation of inconsistent symptoms of a psychiatric diagnosis, inconsistency in reports, and an endorsement of only obvious symptoms of a given mental illness. Even examinee has to pause before every answer and appears to be choosing his or her words very carefully. It may be an indication of deliberate behavior in order to maintain an inaccurate presentation that he or she thinks will be give beneficial for him or for her. Of course, these clinical signs are not sufficient to conclude a person is minimizing or malingering, but they should serve as beginning. So this is all my presentation um, about how forensic assessment instrument need to apply in forensic setups. Thank you so much for watching my video. I'll see you in the next presentation. I promise to declare the truth. Bye bye.